When clients feel discouraged, we want to instill hope. Today I show you two things that when you do them together, they build hope. If you like this video, give us a thumbs up. And remember, when you press the subscribe button, you encourage us to make more videos. Imagine you have clients who tell you they feel discouraged about their therapy progress. Compare these two responses and decide which one you would prefer if you were a client. The first response is, "We've only been working on this for 3 weeks, and it took a lifetime to get here. If we give this approach more time, it's likely you'll begin to see improvement." Or the second response, "I hear how discouraged you feel. You've been working hard these past few weeks, and it sounds like you hope to feel better by now." While the first response correctly points out that meaningful change can take longer than 3 weeks, the second response is closer to what most of us would want to hear. It expresses empathy, first by indicating you heard what your client said, and then by acknowledging some reasons for your client's discouragement. You say, "You've been working hard these past few weeks, and it sounds like you hope to feel better by now." Empathy is the first important ingredient in building hope, and yet empathy alone isn't enough. Imagine a therapist who's purely empathic. The first few times someone expresses empathy feel good, but if 20 minutes later the therapist is still mainly expressing empathy and saying things like, "Yes, I can see how that is discouraging. I understand how painful this is for you," eventually the client is going to switch from being grateful the therapist understands to feeling irritated. "Okay, you feel my pain. Aren't you going to help me?" To build hope, we need to pair empathy with action. What difference does it make if we add this third sentence to our responses to our discouraged client? "I hear how discouraged you feel. You've been working hard these past few weeks, and it sounds like you hope to feel better by now. Let's work together today to see if we can figure out some things that might help you feel better in the coming weeks." Can you hear the difference a promise of action makes? Empathy says, "I hear you." Action statements say, "I'll help you." And when action is collaboratively stated, like when we use the words, "Let's work together today to see if we can figure out some things that might help," then action statements say, "I believe we can do this together." How much empathy and how much action should we use? It depends on the client and the current state of your therapy alliance. First, consider your client's circumstances. Empathy generally deepens emotional response. This is actually one of the purposes of empathy. It makes room for emotion and it validates it. And that validation allows the emotion to grow. So for clients who are already experiencing intense emotion, if there's no therapeutic reason to intensify that emotion further, short expressions of empathy paired with action statements are usually best. For example, think about a client who's severely depressed and says, "My pain is too great. I just can't bear it anymore." That client will not benefit from extensive expressions of empathy. It's better to say, "I'm sorry your pain has gotten so great that it feels like too much to bear. Let's work really hard today to figure out a way to get you some relief." Of course, sometimes therapists stick to empathy because we're not sure what actions to take that will be helpful. Let me tell you, it's still better to move the session to action, even if you don't know what action is called for. Remember, it's not our job to tell a client what to do. It's our job to ask good questions, explore issues and possibilities with them, and help them evaluate what options might be best. And of course, we can also continue to educate ourselves about what evidence-based practices suggest will be the most helpful types of action. for depression, anxiety, shame, relationship difficulties, and other issues. So first, we want to consider the client's circumstances. Second, we want to consider our current therapy alliance with the client. Consider a client who says the following to you at a time when your therapy alliance is on shaky ground. The client says, "You don't understand. My pain is too great. I just can't bear it anymore, and you're just not helping me." In this instance, you want to lead with an acknowledgement of an alliance rupture. "I'm sorry I've not been more helpful so far. I'm so sorry to hear your pain has gotten to the point that it feels like you can't bear it anymore. I'm committed to helping you figure out some things today that will give you some relief. Would you be willing to let me try to help you do that?" This response is respectful to the client, and as a therapist, I'm accepting some responsibility for not helping them as much as the client had hoped for. Then, as a therapist, I'm moving to an action invitation and hoping that my client will accept one more offer of help from me. It can actually be an error to move to empathy alone during alliance ruptures. When clients are highly discouraged, taking action to address the reasons for discouragement is often a first step in resolving the rupture. Therefore, even when there is a rupture in your therapy alliance, expressions of empathy can be paired with promises of action. When would you want to offer more extensive empathy before moving to action? One circumstance might be when clients have never talked to anyone before about an issue. In that case, talking empathically about whatever concerns them for some time can be really helpful. Empathic discussions can help both of you begin to envision whether and what types of action might be needed. You also might want to spend more time on empathy when you're working with clients who keep emotion at arm's length, and it seems they need to feel and process their emotions in order to get relief from their distress. For example, when someone's been betrayed, abused, or suffered a great loss, and they want to move on without any discussion of the impact these events have had on them. On the other hand, signs that you might be offering more empathy than is therapeutic include when you notice the client keeps recycling through the same statements of discouragement and expressions of distress without gaining any new perspectives. Or your client expresses frustration that therapy isn't helping. Signs that you have moved to action prematurely might be that the client keeps interrupting discussions of action steps by continually going back to expressions of emotional distress. This can be a signal that the client doesn't think you've heard or understood their distress, and they need you to express this more explicitly before they can really commit to action. Or you might notice that the client has disengaged entirely from therapy through silence or other signs of non-participation. This can be another sign that you've prematurely gotten into action with them. Of course, in therapy, we often dance back and forth between empathy and action. Both are always really important. We can help our clients maintain hope by paying close attention to make sure both action and empathy are present in every session, especially when our clients become discouraged. As the Chinese author and philosopher Lin Yutang wrote, "Hope is like a road in the country. There was never a road, but when many people walk on it, the road comes into existence." I believe even two people, a therapist and a client, can build a road to hope as long as they keep walking together. You can help build that road with your clients by remembering this equation. Empathy plus action equals hope. If you like this video, give us a thumbs up. And remember, when you press the subscribe button, you encourage us to make more videos. Finally, remember what I always say: watch, read, try it out, and get feedback from your clients. See you next time.